Hi, I'm Julia Benhan, and I'm a volunteer.
As a developmental pediatrician, I get to take care of children with special needs. I also teach all of the residents and medical students that come through about developmental pediatrics.
Tell me what diagnosis the patients you treat typically have.
We see children who may have developmental delays due to things like Down syndrome or Fragile X. We see children who have attention, learning, and behavior problems in school, so they might have ADHD. We also see children who have congenital heart disease that might lead to developmental delays. And we see children who were born prematurely, maybe have fetal alcohol syndrome, have been in foster care, and we assess and treat children who may have autism.
What are some of the services you provide for them?
For many of these children, they don't have diagnoses yet. So we do a comprehensive assessment of these children. We may refer them for therapies like physical, occupational, and speech therapy. We also have a wonderful care coordinator who helps families with their IEPs and actually attends the IEPs with their families to help advocate for the best possible educational program for their child.
Why is early access to care so important?
There is a lot of scientific evidence that early intervention to children with different special needs and developmental disabilities does the most for them the earlier we start. So if we can provide the child with an appropriate diagnosis, then we know what the appropriate treatment plan is, and that child can then get into earlier intervention.
What specifically have the fundraising from the Board of Visitors allowed you to do?
The Board of Visitors fundraising has allowed us to significantly expand services to children and their families. We have been able to expand access to care. We've been able to hire another full-time nurse practitioner and another part-time developmental pediatrician so that the over 2,000 people per year on our waiting list get seen faster. We've also been able to provide developmental pediatric services at all the satellite clinics. The Board of Visitors funding has also given me time as the Director of Developmental Pediatrics to work on program expansion along with education, training, and support to families. They've helped us tremendously to do an awful lot of things.
What do you want to say to everyone who supported Care Card?
I want to say a big thank you to everyone because the Care Card has really allowed us to do so many things here in developmental pediatrics at the Barrow Neurological Institute of Phoenix Children's Hospital that wouldn't otherwise be possible. So thank you.
Thanks for this.
Thanks for having me on your show.